Hello and welcome. You've found the Social Work Podcast. My name's Jonathan Singer, and I'll be your host as we explore all things social work. Today's podcast is on social workers and depression. We usually think of depression as a disorder that affects our clients. We learn about assessment, diagnosis, treatment, referral, and appropriate supervision in our degree programs or in continuing education workshops once we're licensed. We usually don't think about depression as something that affects social workers. Yet a number of studies suggest that social workers experience depression at 3 times the rate of the general public. If depression is such a serious issue for social workers, then why don't we address it more often in our schools and in our workplaces? Well, in today's podcast, I talk with Mark Meier, a licensed independent clinical social worker from Minneapolis, Minnesota, about social workers and depression. Mark and I talked about the personal and professional responsibilities that social workers have in addressing their depression, and the role that schools and colleagues have in supporting social workers to get treatment. Mark shared his personal experience with depression and how it took him away from social work and ultimately led him back. We ended our conversation with a discussion about what programs or workshops schools of social work can provide students to open discussion about this important issue. And now, on to the interview with Mark Meier and social workers and depression. So Mark, thanks so much for being here with us today, and I was wondering if you could talk a little bit about what we know about rates of depression in social workers and social work students.
Sure. You know, the data is fairly limited, and so we're going to rely a little bit on anecdote here as well as the data. But what we know from a couple of studies that have occurred is that we've got some pretty high rates of depression occurring in the professional population. Darcy Siebert, who did a study out of North Carolina a couple of years back, surveyed 1,000 active NASW members, and she found that 19% of those members scored above the threshold for depression on the CESD, which is the Center for Epidemiologic Studies for Depression, which when you contrast that with rates of depression in the general population of probably 6 to 7%, you can start to see that within our ranks we have a serious problem on our hands. Within our student population, I guess I have to rely a lot on my teaching experience, and I teach a course on mood disorders at the University of Minnesota Graduate School of Social Work. And I've had many students come up to me during the course of various semesters and share with me their own struggles and battles with depression.
It sounds like the research has found that there's more depression in social workers than in the general population. Is that true?
That is absolutely true, and in fact, you know, there's another study that's out there. It was done in England, again finding that, you know, significant rates of depression. I believe they found upwards of 15-16%. We're talking almost 3 times the rate of the general population within our own ranks.
That's really interesting. So, did they give any information, or do you have any information about what kinds of depression we might be talking about here that we would find among social workers and students?
Well, and I think this is where we've got some real gaps in our data and our understanding. And, you know, looking at the work that was done out of North Carolina, we'd be talking more using the CESD. We'd be talking more, you know, your garden variety major depression, you know, various levels of mild, moderate to severe depression. You know, I have not come across anything talking about the incidence of bipolar disorder or dysthymia, which quite honestly, I think that the true incidence of dysthymia is quite low, because you're going to find most people with chronic low levels of depression have likely spiked at one point or another and would meet the criteria for a major depressive episode. So the data is not real clear. My experience has been, both in teaching and in talking to fellow social workers, is we're talking primarily about, you know, the major depressive episodes more so than bipolar. But again, bipolar can be very difficult to detect, and unless we're specifically looking for that, it's possible that that's part of the problem as well.
I was wondering, can you talk about some of the unique issues associated with being a social worker and how these issues might be part of this higher rate of depression we see among social workers?
Well, I think the nature of the job itself lends itself to being, at risk for depression. We work in stressful environments. We have high caseloads. We often have unrealistic demands placed on us by the public, the organizations that we work for, to solve problems that are lifelong in developing, and we're given 30 days to fix them. We work in threatening and dangerous environments. And I think when you add all that together, what you come up with, Jonathan, is a picture of ongoing stress. And what we know is that when we don't manage our stress well, whether you want to call it burnout or compassion fatigue or what you choose to call it, I think what it is most of the time is depression. And there is such a growing body of literature demonstrating that link between stress and unremitting stress and the onset of depression.
So it sounds like you're talking about perhaps people come into the profession, they have a predisposition for depression, or they might have a vulnerability to depression, but it's the environment in which many social workers work that would trigger this depression, the stress, the high caseloads, and the fact that it's unremitting. Did I hear you right?
Yeah, I think so, and I think historically, social work is a field in which predominantly females are in, and the data suggests that women suffer from depression at higher rates. I think that along those lines, a lot of men are unwilling, unable, or simply refuse to admit they're suffering from depression. So I think there's some differences that could be explained between the genders there, but I do think that a lot of us go into this field and we're caring people, and perhaps our perception of what we're going to be able to accomplish with our clients and the reality, sometimes those two things collide head on, and it can become very disheartening and very frustrating. You can sort of see the end of the light at the tunnel for your clients, and when you're unable to steer them towards that end of the tunnel, that takes its toll on people.
Now, you've talked openly about your experiences with depression, and I was wondering if you could share a little with us about that.
Sure. Well, I'm one of those guys that went into graduate school suffering from some challenges with depression. I was first diagnosed with my own depression and anxiety issues way back when I was in college 20-some years ago, and ignored it for a long time and made it through graduate school. And like a lot of people with depression, I sort of put on my game face and made it through life. And it was the stress of being a social worker, I believe, in many ways. I mean, there was obviously many other factors associated with it that really set me sort of in a downward spiral to the point where I did become very depressed, very suicidal, and in fact had to, I purposefully left the social work field for a couple of years with the thought that would fix my depression, and lo and behold, of course, it didn't, and I ended up being hospitalized and basically out of commission for a few months while I got myself back in a functional position.
What should social workers who are dealing with depression be aware of?
Well, I think this is one of the challenges because that, for so many of us and so many of people who have depression there's a real lack of insight. I mean, as a social worker, I had a pretty good sense, and I have a very savvy wife who knew what was going on with me. And, I still had these blind spots where I simply couldn't face the fact that I was depressed. I was the clinical social worker. This shouldn't happen to me. But I think what we have to watch for is any changes in sort of our practice patterns. I'll tell you what happened to me, Jonathan, is I'm a pretty profoundly optimistic person. And in the throes of my depression, as so many depressed people suffer, I had become profoundly negative and pessimistic. And, I'd get done with a client and I would be thinking to myself, what is the point of this? I can't help this person. There's, nothing's going to happen. And that was a real wake-up call for me that something was going on with me. And so we really do. We owe it to our clients. We owe it to ourselves. We owe it to our colleagues to be aware of sort of these changes that occur with depression. The negativity, the loss of concentration, the inability to focus, the being unable to be present with your client. Really being self-aware, regardless of whether you're a psychotherapist or a case manager or whatever it is you do. You need to be aware of how you're operating with your clients.
At any point, did any of your clinical social work colleagues say, Mark, seems like you're having a tough time. Are you depressed? Have you thought about getting treatment? I mean, did anybody come to you and say, I think you need some help?
No. And I think what I became, and certainly having gone back and talked with people, but what I became was that difficult colleague. I was moody. I was unpredictable. People described they needed to walk on eggshells around me. And I mean, I was classic, Jonathan. I mean, I was oozing depression all over the place. And nobody did say anything to me. And certainly that, may or may not have had an impact on me. I think that from a supervisory standpoint, I probably should have been, monitored much more closely. But yeah, nobody came forward, and nobody. I worked with a physician at the time in the setting I was in, and not a psychiatrist. But he said to me, Mark, I think we need to talk, and I didn't really follow through with him. But none of my social work colleagues really did say anything.
It's ironic that we're in a helping profession and you were suffering from one of the most debilitating diseases out there, and none of your colleagues said anything. And the one colleague that did, you didn't follow through, and which
Right.
sounds like classic depression. So I guess the question is, what should we do if we suspect that one of our colleagues or a fellow student is suffering from depression?
I think we have to start really and obviously my biases are such that I think we need to enhance the awareness and the education of depression starting in our schools of social work. And I know that most of us have classes in psychopathology and mood disorders, but if you think about our work and who we serve, we really, really need to emphasize depression because it is the most prevalent mood disorder. It's the most prevalent mental health issue we are going to encounter in our work. And so we really have to raise the bar in terms of awareness and what is depression. I'm often surprised by students or even colleagues' lack of understanding of depression and sort of the buy-in to the stereotypes of, well, depression is you're crying and you're sad, when we know depression is so much more than that. But I think what we need to do is we need to feel comfortable going to our colleagues in a manner that conveys caring and compassion, and we say to them, look, I'm concerned about you from many levels. I'm concerned about you as a person. I'm concerned about you as a colleague, and I'm concerned about the clients you're serving, and we need to have systems in place so that social workers can feel safe in getting help. When you look at the limited data, the reason people don't get help is they're afraid for their license, they're afraid for their job, their supervisors don't understand it. I think within our schools of social work, I suspect students don't feel too safe going to advisors or deans and saying I'm depressed. I've had students say I'm afraid I'll be put out of the program or I'll have a mark that follows me. So creating environments and cultures that understand and want people to get the help, because on the other side of being depressed, what you generally find is, people who are more motivated than before and who are more self-aware than before and, can become very, very effective in their work as social workers.
It sounds like you're suggesting sort of this revolutionary idea that we practice what we preach.
Well, unfortunately, I hate to make it sound that simple, but I think that is true. And that is really, and we all get caught up in busy days and busy schedules. I mean, I'm never at a loss for how busy everyone is, but I think it becomes this imperative that we simply recognize what's going on and absolutely we practice what we preach and that we create places, we create whatever it might be, whatever the system might be, for people to say, yeah, you know what, I am really struggling and I need some help. Because the longer we let this go, the worse people get, the less, able we are to treat them, and just the more difficult the disease becomes. And quite frankly, the more professional challenges people end up creating for themselves.
So if we start in schools of social work and we create an environment where suffering from depression or dealing with depression is not stigmatizing, if we allow students to actually talk about this openly to the extent that they want to, recognizing that it's important that they seek treatment, that they get the help that they need, that this is a good first step in addressing this issue of what to do in the profession with people with depression.
Absolutely. And I think, what goes along with suffering from any sort of mental illness is this accountability for the person who is suffering. Just because I was depressed, it doesn't mean that I get to continue going through my career as a social worker, making life miserable for my colleagues and God knows what you could be doing with clients. And so I think that, this environment includes several layers of not only a place to self-disclose or to educate about depression, but to create the accountability within the profession that, we expect you to get better. We expect you to get the help you need. Because, letting someone go through life with unremitting problems and not challenging them, to me is counter to what I'm trained to do as a social worker, and I think it's it shows a level of respect and compassion and caring for others to point out what's going on and to expect them to get the help. And I think that spending the time at the graduate level, the undergraduate level, to really educate people about stress management techniques for themselves. We talk all about all the work we need to do with our clients, but raising that level of awareness about, how do we manage our own stress? How do we recognize depression? How do we, deal with the fact that there's a 20% prevalence, lifetime prevalence rate, and that there's a fairly good chance that many of our colleagues and fellow students are going to deal with this at one point or another.
I really like the point that you just made, which is you have a responsibility to get better so that you can provide the services that your clients need. And, I want to bring this back to your story. You said that you left the profession and then you came back. What happened with that? How did you decide to come back?
Well, when I left, my situation was such that I was suffering one of the classic wanderlust aspects of depression, and I found no satisfaction in being a social worker, which really had nothing to do with being a social worker. It had to do with the fact that I was depressed. And so, it was a good opportunity. I like I said, I have a very savvy wife who's a medical professional, and she pointed out to me what was going on and pointed out to me that I wasn't willing to get treatment at that point. And so I took an administrative type job. And then finally, everything sort of caved in on me, and I ended up hospitalized and suicidal and getting treatment, etc. When I got out of the hospital and spent the next probably year and a half going to therapy, getting adjusted on medication, and coming out of my depression, what I really saw was, look, I am a social worker at my core. And it did, as I said, in my instance, create a whole new level of self-awareness about the impact of mental health issues, of difficult life struggles in general on the clients that I served. And so in my instance, I was able to learn from my own rather unpleasant experiences and relate them back to the clients I serve. And like so many people, I went through a profound point in my life, and I want to go back and help others understand that, the treatment is a lot less difficult than the living with the disease. And the sooner we sort of take this time to get the help we need, ultimately, in most instances, the happier, the more effective, the higher quality of life and the better professional we will be.
So if we have a personal responsibility to heal ourselves, right? Is there a responsibility that we have to point this out in our colleagues? Because I think for me, this gets to kind of the sticky issue of, let's say, I'll just put the question out to you. Since you've been back in your clinical social worker role, have you come across colleagues that are depressed? And if so, what have you done about it?
I have come across colleagues that are depressed, and what I do is I point out to them what I see. And it hasn't been anyone that I've worked directly with, so I think that would be a little bit of a different scenario. But certainly, after doing talks and I have the opportunity to talk all across the country about depression, and people have come up to me and said, I think I'm really suffering. And what I try to do is, look, I point out to them what I said earlier, is that you have a responsibility to get treatment, and you need to make sure that your personal situation is not impacting particularly your clients, and importantly your colleagues and your family and your friends, etc. But I think in any workplace setting, whether it's social work or a law firm, if people are unable to perform their job effectively because of a physical condition, a mental condition, whatever it might be, we do need to point this out. And I believe we have a very strong ethical responsibility to our clients to point out to others if indeed they are not, performing up to the level the client needs them to be performing.
So it sounds like you have addressed this issue with colleagues, but they haven't been people that you work directly with. And
Correct.
It seems like that right there is kind of the sticky issue.
Right.
Do you have any ideas or recommendations? And I'm thinking specifically about folks who are listening to this, who are saying to themselves, "Wow, now that now that I think about it, I think so and so is probably depressed."
Right. And I think what you start getting into is some of the legal issues, and again, this cuts across all situations. But I do believe that what we do in social work, that there is a even more urgent need to address the issue in colleagues, because I will tell you that when I was so depressed, my interest in helping my colleagues, my clients, was not very high on my priority list. And yet these folks were coming to me with, the expectation that as the professional, I was there to help them. And so I believe that, if this is occurring in your colleague, it's imperative that you talk to whether it's an HR person who's in charge of this, whether there's a supervisor that's in charge of it. I think in the perfect world, you approach the individual as a professional, as a colleague, and raise the issue to them. And if they choose not to do anything about it, I think you have to take it to sort of that next level, depending upon where you work, and get it addressed, because we obviously erode the credibility of our profession if we are allowing, people who are not capable for whatever reason to continue practicing. And beyond that, we have very, very vulnerable people coming to us who need people at, the top of their game, if you will, to be providing services.
So it sounds like there's no magic solution to this one. Just sort of doing what we do, connecting people with resources, making it known. It sounds like you sort of stop short of saying that, I would have a responsibility to sort of make this an issue if one of my colleagues didn't want to address it in themselves.
Well, then let me. If that's, I certainly don't mean that to be the perception, because I do think you have to make it an issue. And I think that people ought not be practicing who are suffering from profound depression that is getting in the way of their ability to effectively perform their job. Because again, we wouldn't let somebody who's actively abusing alcohol or drugs take care of patients, and that impairs your judgment, it impairs your thinking, it impairs your compassion, it impairs so many different things, just like depression does. And we want people to get better, and we want people to get the help they need, but at the same time, we need them to not be negatively impacting their clients by continuing to practice when they're suffering and when they're struggling. So I think it absolutely needs to be made an issue, and it's always it's always challenging to think about and talk about where I was at, but I was simply ineffective as a social worker, and not only ineffective, I think I could very well have been damaging, and needed to not be working directly with individuals at that point in my life.
That's quite a thing to be able to admit to, because I think all of us have underperformed at our jobs at some point or the other, but to actually be able to sit back and say, wow, I think I might have been doing harm is pretty profound. And I think most people would agree that's not why we came into this profession. I did not become a social worker because I want to make your life more difficult. Maybe we can take a step back here, and clearly there's some challenges talking with a colleague about their personal life, especially if that personal issue is a struggle with depression that might be impairing their job, their ability to do their job. And earlier you talked about talking with students and making the schools of social work and the educational experience a different environment, a place where they can begin to address these issues in themselves and really understand why, in the bigger scheme of things, it's important to address their own depression. So I was wondering what might you suggest that we offer in the way of education or preparation to students as they enter the field to help them cope with stress and depression, so as to perhaps make it less important for or less necessary for colleagues to be the ones to intervene?
Well, I think that, since we know that depression is probably the one issue that is most likely to occur in your professional career. I think you offer classes. I think you offer seminars. I can't speak to each individual institution, obviously, but I think you make it a priority and you say, look, we are going to work with you over the course of a quarter, a semester, and we're going to teach you about professionalism. We're going to teach you about boundaries. We're going to teach you about managing your stress. We're going to teach you about, your self-recognition of your own feelings and your own thoughts about the work you're doing. I recall when I was, and I don't know that we have to go back to this, but it struck me. I was in graduate school back in 1992, and one of our adjunct professors, I remember him saying that he went to graduate social work school in the 60s, and the program he went to, every social work student was required to go through some actual counseling sessions, with this idea that they would try to find anybody who was struggling or having problems and work with them to make sure that they were as well prepared as possible to go into the field. I think it's inherently irresponsible to think that we don't have this issue in our students and in our professionals, and to sort of look the other way and launch people into a career that they're not prepared for. And I think it, like I said before, it does a disservice to our clients, our colleagues, ourselves, and certainly our profession. I mean, if you take a look at medicine, physicians have notoriously ignored this issue, and they have profound rates of depression and suicide. And they're finally starting to sort of own up to it. There's all sorts of campaigns in medical schools to train residents, interns, medical students to be aware of depression. The American Foundation for Suicide Prevention has put out a fantastic program for medical students. So we need to do the same, because we have equivalent, if not higher, rates of depression in our field.
So there are other professions that are grappling with this, and it sounds like doing a better job of addressing the issue. And what you mentioned about students getting their own counseling, I remember having an adjunct who said the same thing to our class. And I also remember thinking that it was great that we didn't have to do that, because, boy, who had time to go to field and do classes and then get into counseling?
Right.
And in retrospect, I think it would have been good if there had been a little more urging on the part of the school to deal with your stuff. I decided to go see a counselor in part because I actually thought the adjunct's idea was good. And I found it an amazing experience that I draw from in my own clinical work to this day.
But I think to make it part of the curriculum, like you said, we don't have time to go to field, and we don't have time to do the work, and many of my students have jobs and families, and so to add another layer maybe creates a burden. And even though we can't mandate it within the educational setting, there are other avenues to deliver this information through regular coursework or course offerings. And it goes back to what you just said. Just going through that counseling experience puts you in that position of what it feels like for your clients to be in that spot. And it's if you draw on it today, it was obviously a very important aspect of your education.
Yeah, it really was. You've mentioned a couple of times that there are ways to integrate this information into the curriculum, and I'm wondering if you could mention some specific classes or workshops or things like that you've either been a part of or created or think theoretically would be useful that educators who might be listening to this podcast could consider incorporating into their own schools of social work.
One of the things that I've had the opportunity to do is go back to a few various graduate schools throughout the country and do just short 2, 3, 4-hour workshops either at night or on a Saturday where the topic is depression and the word client rarely comes into it. It's about talking to the professionals. It's about opening up dialogue about and you get people who self-select and likely are struggling with the issues who come to these seminars. I recognize that. But it gives an opportunity for people to talk about their own struggles and their own fears about what do I do with this? Who do I turn to? Do I dare bring this issue to light? And what most people will find is that in talking to others who have gone through it, they recognize, okay, the likelihood that I'm not going to lose my license is very high, and that ultimately if I get help, I will probably be a more effective professional. In my own class that I teach at the U, I've given students the opportunity. We'll take a couple of classes and we will talk about what are your own experiences with depression? And again, within the context that nobody is compelled or, I hope I do a good job of creating an environment where people don't feel, cornered to share or to create, issues that don't exist, but to demonstrate that, this does happen, and a lot of people, when given the opportunity, will talk about it. And, the very first time I shared my own experiences in my class was a big struggle, and I went to the dean and the associate dean, and I said, this is what I'm going to do, or this is what I'd like to do. What do you think? And, I think with appropriate mulling and conversation, we came to the conclusion that, using some good common sense and being careful with, specific details, which I'm always aware of, they said, yeah, why don't you try it? Well, I can tell you the response was overwhelming. And my students were so grateful to hear somebody say, you know what, I had these problems, I got over them, and here I am today as effective, actually more effective and successful than I was before.
So this is coming full circle. So you were able to bring in the experiences that you had with depression to bring up the subject with your students, which then resulted in really an opening of the dialogue for them, which is exactly what you said you wanted to do in the first place, which is get students
Correct.
to think about this, to talk about this, so that when they go into the field as professionals, this is not a taboo subject, so that they can serve their clients the best that they can.
Exactly. And I hate to be cliche, but, if I had diabetes and I was teaching in a medical school, I would openly share challenges I've had with managing my glucose or my diet or my exercise. Depression is a biopsychosocial issue, and it is not taboo. And we're getting there, but we need it to get more out on the table so people can talk about it.
Well, Mark, I really appreciate you taking the time to talk with us today about your experiences with depression, but the issue of depression and social workers in general. And I think that, I don't know about our listeners, but I have certainly learned from you about the importance of bringing this up in class and being aware of it in colleagues. So thank you so much.
Oh, yeah, my pleasure, and I really appreciate you bringing this to light, and I hope people will embrace it and think about it, because I think that's all I would ask at this point.
I'm Jonathan Singer, and thanks for being with me today for another episode of the Social Work Podcast. If you missed an episode or have suggestions for future episodes, please visit socialworkpodcast.com. If you'd like to support the podcast, please visit our online store at cafepress.com/swpodcast. To all the social workers out there, keep up the good work. We'll see you next time at the Social Work Podcast.